Hello, my name is Hannah Glass, and I'm a student nurse from Delaware Technical Community College. I'm here to teach you about kidney transplants and what you as a nurse need to know in order to properly take care of these patients with kidney transplants. So, first of all, what is a kidney transplant? A kidney transplant is a surgical procedure that uses a healthy kidney from a living or deceased donor and places the kidney in a client with kidneys that are no longer functioning. Assessment wise of your patient that is going to need this kidney, you're going to see things that relate a lot to your fluid and electrolytes because their body is not able to get rid of the fluid and the excess electrolytes in their body. So you're going to see things such as hypertension, heart failure, edema, pericardial effusion. You could see some gastrointestinal things such as stomitis, anorexia, respiratory. You could hear crackles. They could have shortness of breath. They could possibly even have edema in there as well. You're going to see possible blood in their urine, protein. They're going to have oliguria, less than 30 milliliters an hour of urinary output. And neurologically, because of those electrolyte imbalances, you could see tremors, jerky movements, decreased level of consciousness, seizures, and lethargy, and even coma. So a lab that you really need to be focused on as a nurse is your glomerular filtration rate, because this is going to tell you where your client's kidneys are at. Most, if not all, of clients that are getting a kidney transplant are going to be an end-stage renal disease, so they're going to have a glomerular filtration rate of 15 milliliters or less a minute. They're also going to have decreased hemoglobin, hematocrit, red blood cell count, calcium, and they could be in metabolic acidosis. Their kidney panel labs are going to increase, so they're going to have increased creatinine, BUN, as well as the increasing potassium, magnesium, and phosphorus. So one thing that you want to think about as a nurse is my patient going to have a good probability of transplant success? So you're going to want to have a healthy client in terms of not having cancer. You're going to want them to not be abusing any drugs or alcohol. No severe cardiac or peripheral vascular disease, because that's going to affect perfusion to that new kidney. No active or uncontrolled psychiatric disorders. No documented history of medical incompliance without reasonable justification. No severe pulmonary hypertension, and no BMI of 35 or more. And if they do have a modifiable contraindications, we're going to want to do patient teaching so that we can get them on the list as soon as possible. The donor is also going to be having some qualification standards as well. They need to have normal kidney function. And if it's a living donor, you're going to want to make sure that they don't have uncontrolled hypertension, diabetes, cancer, or any acute infections. And you're not going to want them to have any HIV or hepatitis positive tests, because then they could give that to your immunocompromised patient. So some things as a nurse that you need to be thinking about pre-operative is you're going to be wanting to give them their prophylactic antibiotics. They're going to be on immunosuppressants and monoclonal antibodies in order to prevent rejection of that new kidney. So you're going to want to be very careful with infection prevention before and after surgery. They're going to continue to be on dialysis up until they have their surgery, because you're going to want to prevent uremia in their body. You're going to want to make sure you do proper teaching, and we'll get into that a little bit later. And you're going to want to make sure that they have given consent. So post-operatively, you're going to want to continue to do your vital signs every 15 minutes and then every hour as per protocol. Your urine output is really going to be one of your biggest indicators on how well that new kidney is doing. You can expect to see some pink and blood-tinged urine at first. That is normal. But you are going to expect to see 30 milliliters an hour or more of urine output. And if that goes down for any reason, then there's a problem with that new kidney. You're also going to need to assess the need for bladder training, because around day 2 or 3, we're going to take out that catheter and we're going to start intermediate catheterizations. And we're going to retrain that bladder that has probably gone through some atrophy as the patient has been having decreased urinary output, olguria, while they've been getting their dialysis or whatever else they have been getting to get rid of the fluid and the waste in their body. You're going to want to assess their surgical site, because you do not want it to be bloody, because that could be indicative of a hematoma or hemorrhage. So some post-op things that you need to be doing is daily weights, monitoring their fluid and electrolyte balances, monitoring for infection, monitor for rejection, and that includes pain at the site or fever or sudden anuria. You're going to want to administer IV fluids and give oral fluids as soon as they have return of the bowel sounds, because you're going to really want to try to promote urinary output. Prevent atelectasis and pneumonia by using that spirometer. You can turn them every 2 hours. Catheter care is very important because these patients are at risk for infection. You're going to administer their immunosuppressants, their stool softeners, and you're going to want to refer them to support groups. You're going to want to refer them to a urologist, because these patients are going to need follow-ups for the rest of their life to check on that kidney function. Some possible nursing diagnoses that you need to be thinking about is the risk for infection, urinary retention if that kidney does not work, readiness for enhanced knowledge, because their life is going to be totally different now. They could have some acute pain, so you want to take care of that with your pain medicine. Risk for ineffective renal perfusion, risk for imbalanced fluid volume, and risk for electrolyte imbalance. These are all things that you need to be thinking about for somebody that's getting a new kidney. So preoperative planning, what do we really want to make sure is going to happen for this client? We're going to want to make sure that they have effective fluid volume. They need to be infection-free, and we really want to make sure they have a functioning urinary system. So some implementation, we're going to monitor their urinalysis, their daily weights, their fluid and electrolytes, manifestations for infections, and excessive diuresis. You're going to administer their oral fluids as soon as you can. Urinary catheter care, very important, prevent infection. Diuretics for promoting that kidney to start working. Immunosuppressives to prevent rejection of that kidney, and stool softeners just to help everything going. So some teaching, we're going to do some teaching on their medications, which we'll get into in a minute, as well as their diet, and we're going to teach them about manifestations of rejection. So for medications, you're going to want them to really monitor their blood pressure. You never want them to stop medications suddenly. But honestly, they shouldn't be stopping these medications at all, especially the immunosuppressants, because they're going to be taking these for the rest of their life, for the rest of the life of this kidney. So because they're taking these immunosuppressants, you want to let them know that they're at increased risk for infection, so they really need to be doing proper hand hygiene, staying away from people that are sick, and properly cooking food. You're going to want to monitor and report respiratory changes. Tell them to avoid grapefruit juice with cyclosporin because it affects how it is metabolized in the body. They may also need to take magnesium with this supplement because it depletes the magnesium in the body. And they need to carefully be monitoring their sodium. But honestly, they should be monitoring their sodium regardless of what medication they're taking, because we want to prevent hypertension. We do not want to cause hypertension towards and have perfusion issues for that new kidney. So their diet needs to be low fat, high in fiber, high in protein, and low in sodium. Some other things you need to think about is adherence is really important. You need to explain to them what could happen if they do not follow this patient teaching. The kidney life of their new kidney is around 15 years. It'll reject very slowly, and eventually they'll have to go back on dialysis, but if everything works out how it should last them for quite a long time. They're going to avoid smoking, avoid alcohol, and you want to have them avoid contact sports because we don't want them doing anything that could further damage that kidney. So some signs of organ rejection. We have 3 phases. The hyperactive occurs immediately up to 2 days after surgery, and you're going to remove the kidney immediately. Acute usually occurs within weeks, and that is death of the kidney to an antibody-mediated response, and in this case, we're going to increase the immunosuppressants. Chronic occurs from months to years, and this is just a result of the fibrotic tissue replacing healthy donor tissue over time. And you're just going to want to do conservative measures with them, make sure they're following their diet, they're taking their meds, and you're going to want to diagnose these through ammonia levels in the blood, fluid retention, electrolyte imbalances, fatigue, and kidney scans and kidney biopsies are very important because that gives you a look at the kidney and how the kidney is doing. You're also going to want to do your glomerular filtration rate because, like I said earlier, that is a good indicator of how your kidneys are doing. So one thing that I thought was really important to touch base on, because we're living in a global pandemic, is how the global pandemic is affecting our immunocompromised kidney transplant patients. So this is just a little study that I found. It was a bunch of patients. All these patients had kidney transplants. They were on immunosuppressives and antivirals, and they lowered their immunosuppressive so that they could treat this COVID-19, and even still, there was a mortality rate upon these participants of 21.1%. That's high because our national mortality rate for COVID is only 0.6%. So the conclusion, in this case, they wanted more research because this is COVID-19 is something new that has just happened. But I think it's pretty common sense that you really need to educate these immunocompromised patients to take all the proper CDC guide recommendations when it comes to avoiding COVID and avoiding contact with people with COVID. So, protecting them from infection is very, very important. You're going to want to make sure that they have regular exams with their doctor. You're going to want to refer them to the urologist. You're going to want to check their GFR rate constantly, their WBC rate. You're going to want to keep them up to date on their vaccines. After surgery, you're really going to encourage that spirometer use, and they need their yearly flu shot and prophylactic antibiotics post-op. So that's pretty much all I have for you guys. If you guys have extra time on your own, I have listed a few questions on the next slides to come for you guys to practice yourself on what you learned. And thank you very much.